Hi there, everyone, and welcome back to Do Your Parents Want to Stay Home, a weekly virtual caregiver education series. I'm Infinity Martin, Community Health Engagement Specialist here at Sugar and Spice In-Home Care. We're a nurse-owned and operated chronic illness and caregiving management agency, proudly serving Flagstaff and roughly 1 hour radius surrounding. Our specialty is helping older adults truly thrive as they age in place wherever they call home. And I'm here with Regina.
Hello.
And we're going to talk about sundowning today.
Yes. All right. Thanks for joining us. Welcome back, everybody.
Yes, so what exactly is sundowning?
So sundowning is mostly known as a time in the afternoon, usually late afternoon, where people start to get really confused on a consistent basis. And it's kind of a pattern that will develop. And it's just where people become way more forgetful, a lot more difficulty concentrating,
Hmm.
and they might become agitated, restless, just not sure what they need, but they're very needy. They need a lot more reinforcement. They might be sad, they might be angry, they might be more spontaneous or less predictable. Um, so that's kind of what it's characterized by. What causes it is still up for debate, but they're thinking that it is a combination of things. It could be environmental factors, but also people with dementia, Alzheimer's, things like that, because dementia is a brain disease, right? So it's affecting things in the brain like your neurotransmitters, serotonin levels, acetylcholine levels, melatonin levels. Um, Things that are affected because the brain is just not working like it should.
Hmm.
And so the sleep-wake cycles are off, the circadian rhythm is off. Dementia affects their sleep patterns. So then if they are not sleeping well at night, then this is just going to add to their confusion. And it seems to kick in the afternoon after, a full day of even just being awake,
Okay.
and to having different activities throughout the day, which is good. Not like we want to limit activities. We want to keep that stimulation up. But anyway, so that's kind of what it is. And there's definitely some things that we're going to talk about today that can add to or make it worse or make it better. Some strategies to help you get through that part of the day and understand a little bit more about what causes it and how to treat it.
Okay. So, and then how would you know if it is actually sundowning or if it's just, say, a bad
Mhm.
night?
Yeah. So sundowning traditionally is you're going to notice to see a pattern in their day. It's something that's probably going to develop slowly over the course of several weeks or months. Um, and so if you're just starting to see in the afternoon all those symptoms that I just said, it's most likely sundowning. Usually kicks in around 3 or 4 in the afternoon.
Okay.
If if your loved one just suddenly has a lot more confusion one day in the afternoon, a lot more agitation, if it's a sudden change, you're going to want to look for signs of or that could be a sign of an infection, right? We've talked about that a little bit, that in our elderly population, infections present completely different than they do when you're younger. When you're younger, you get an infection, you probably have pain wherever the infection site is.
Hmm.
Um, the classic thing for causing confusion in our seniors with an infection is a urinary tract infection, and they won't have some of the same symptoms that you would normally present with the burning with urination, abdominal pain, nausea, maybe low back pain with the kidneys. A lot of times, your first sign with a senior who has an infection, you're going to see weakness, you're going to see loss of appetite, and increased confusion. So if that presents suddenly, you may be looking at an infection. You also want to just make sure that there's not a sign of a stroke going on. Strokes can come on suddenly. You can have TIAs, uh, tran transient ischemic attack. I forgot the first word. where you may see um, sudden inability to find their words, slurred speech, confusion. They may have weakness on one side of their body or tingling, loss of sensation on one side of their body. The obvious thing, facial droop on
Hmm.
one side or the other. Things like that can be sign of a stroke. So just not to rule out something more significant. But
Right.
yeah, sundowning is more like a slow progression of a pattern.
Okay.
Mm.
And then how can a family caregiver prepare for their loved one experiencing this?
Yes. So the key is to recognize that this is what's going on. So again, back to what causes it. So we're looking at just the disease of the brain, not much you can do to affect that. However, so if we talk about um what causes it in the chemical side of things. So what can help is improving their sleep. So if someone is napping off and on all day long, they're not going to want to sleep at night. That's that circadian rhythm that we can try to attack. So prevent naps. If they need a nap, try to limit it to 30 minutes at a time during the
Hmm.
day and just one or two.
Okay.
Don't let them just snooze off and on all day. That's going to mess them up.
Hmm.
Um, the other thing that you can do is add some medication, so or supplements, just like melatonin at night, can help maybe about an hour before bedtime, and then magnesium.
Hmm. That's a
There's
good
so there's
one.
like several forms of magnesium, but magnesium glycinate is very good for sleep. Can be given in a tablet form or through your food. There's some foods, seeds, black beans, pumpkin seeds, dark chocolate. Hey, I would
Ooh.
choose that one every night. Give us a dark chocolate for me, please. But you can also get it in tablet form, just available over the counter, 100 to 300 milligrams a night, about an hour before bed. Can also really help with sleep. I've seen it work very well where we combine a small dose of melatonin and magnesium about an hour before bedtime, and they fall asleep easier and stay asleep
Okay.
longer. Also, as a prescription, trazodone can help with sleep at night. Trazodone is Trazodone works on the serotonin and acetylcholine receptors to inhibit the things that cause fight or flight, and then also to add to the chemicals that cause a little bit of drowsiness. So it works in a few different ways. Trazodone is very common for helping dementia patients sleep at night. And then other things that you can do is just try to plan your activities in the morning. So if you have doctor's appointments, if you have an outing that you want to do for fun, any kind of exercise programs that you're doing
Hmm.
with them, going for walks, you want to catch them during their most physically alert times of the day. This is also important for safety reasons because they're more their mobility, their balance, coordination, all that is going to be better in the mornings than it is at night.
Right.
So, doing that and then planning to just have the house start to just be more still and quiet, less stimulation in the afternoon is better. Um, all those, if you can imagine, their brain is just getting tired. It's not going to be able to process information as fast. They're going to be more agitated because it's like I don't know if you can imagine a scenario where you've got a bunch of kids playing in one room, there's toys everywhere. In the middle of that, you're trying to cook dinner. This is a scenario that you can probably imagine.
Yes.
The TV's on, there's noise there, there's the neighbor kids outside playing, people coming in and out of the door. It's kind of like that is that is how loud stimulation becomes to our dementia patients in the afternoons that are suffering from sundowners.
Mm.
So if you can quiet their space, if you can limit stimulation, these are all things that can really help to make your evenings a little bit more successful and less problematic.
Okay.
Yeah.
So, and does this only happen to people with dementia?
We have seen it happen with some of our patients in the hospital
Hmm.
that are there for a prolonged amount of time and their sleep-wake cycles are messed up. A lot of it has to do with sleep.
Hmm.
Your folks who are struggling with sleep apnea
Hmm.
may also have some sundowning issues where they just
Okay.
can't focus and they get more confused and forgetful in the afternoons. So,
Hmm.
but yeah, anything that's just a constant something that is disrupting their daily lives, like being in the hospital, is
Yeah.
very disruptive to their normal everyday, what they would do at a certain time. Things like that can actually cause sundowning too.
Okay.
Yeah.
Yeah. Being checked on every 4 hours and being disrupted, it
Yeah.
definitely, I can see that, why that would happen.
Yeah. Sometimes every hour.
Yeah.
Yeah, in the hospitals.
Hmm. And are there certain triggers that make sundowning worse?
Yes. So we talked about it a little bit, but the in addition to sleep, in addition to the chemical imbalances, just not having there could be just they're hungry, it could be they're thirsty, it could be that they're in pain, and it might be that they just need to go to the bathroom.
Hmm.
Constipation can make it worse. So if you're starting to see that, just have a plan ahead of time. Plan to do an afternoon snack around 3. Plan to have, make sure that your loved one has a glass of something to drink next to them at all times. If you can, again, look at what's causing the extra stimulation in the house. It might be as simple as you transition at 4 in the afternoon and go start making dinner. Just that little bit of a change in the activity around them can cause them to become more confused.
Hmm.
So, if there's things that you can do to prep for dinner, that's happening during the mornings or a lunchtime that you can start to prep for dinner, crock pot meals, things that keep the stimulation down around that busy hour, 4, 5, 6, 7 o'clock
Hmm.
can be really helpful.
Okay. And well, you just talked a little bit about that, but what are some more strategies that can help?
Yeah, so um, offer bathroom breaks, even if they're not saying anything. If you just notice they're agitated, just say, "Hey, I haven't been to the bathroom in a while. Do you need to go to the restroom?" And then that might be like, "Oh, yeah, I think I do."
Hmm.
Because as a lot of our dementia patients, they start to lose their ability to communicate and process thoughts. So if they're struggling with that already, and then it's worse in the evening, it might be as simple as I haven't peed in a few hours and I really gotta go, or maybe
Okay.
my brief is wet and I don't feel comfortable.
Hmm.
They probably get cold too. That's the other thing that happens. As the body starts to slow down with these circadian rhythms, and if they're not sleeping well at night, you're gonna just be cold. So even just bringing them an extra heated blanket that you pulled
Hmm.
out of the dryer, um, something with lavender. They make some really nice candles and scents. If you can turn on a diffuser in the evening, that can be really helpful too. Start that around 3 or 4 in the afternoon and just get a nice calming scent going on in the home.
Hmm.
Lavender is great for that. You can also put a little bit of peppermint in there. Peppermint can be stimulating, but it can be really good for pain. So if their pain is increasing in the afternoon, that can be a part of it. A little bit of peppermint oil, essential oils mixed it with some coconut oil and just massage that onto their knees and ankles or their low back or wherever they have pain.
Hmm.
Can
Sounds
really be
nice.
soothing. Yes. Um, some nice quiet music to just, and if you can separate them, get them away from all the busyness that's going
Hmm.
on in the house. Maybe they can have a private space in their room with just, just some nice music on and um, the other thing, make sure that your lighting is on
Hmm.
during the day, right? So sundowning,
Right.
if you think about it,
Uh-huh.
it's when the sun starts to go down.
Hmm.
In the summertime, it's not as bad, but in the wintertime, make sure you've got some nice bright lights on, through at least 6 p.m., I would say, just to keep that brain alert that it is awake time. And then we have wind down and sleep time. So you
Yeah.
want to start turning the lights down a little bit, maybe just have a few lamps on. After that, that's fine. But you want to keep your windows open, your blinds open, open them, in the morning. Even if your loved one likes to sleep in,
Hmm.
you don't have to necessarily come in and wake them up, but just their brain sensing that sunshine through their closed eyelids
Okay.
can even just help to regulate that circadian rhythm of day and night,
Oh.
day and night. So keeping the lights on, also with people that have more confusion in the afternoon, or if they're visually impaired, that dim light in the house can make things more confusing.
Hmm.
So keep the lights on, keep it bright and warm in the house. Let's see. What did you just ask me? Because it made me think of something else.
What kind of strategies could it help manage this?
Okay, so we talked about the magnesium for sleep. Magnesium can also help with constipation.
Oh,
So you
okay.
might be able to kill two birds with one stone with
Hmm.
that one. Um, Give the magnesium at night because it does help them sleep. And as long as you're keeping a low dose, shouldn't cause diarrhea, but watch out for that because it can. If you're giving magnesium every single night, you might start to see some loose stools.
Right.
If you do, then just hold off on the magnesium for a night or two until that clears up. You may need to just keep it a low dose.
Hmm.
Yeah.
And then also I know because well I take magnesium glycinate and
Mm.
you're not supposed to mix it with other magnesiums because you can get too much magnesium.
Yeah.
So just
Smart.
side note.
Yeah. You don't want to add you don't
Yeah.
want to add a problem is the why
Yeah.
they can't sleep at night because they're
Mhm.
up and down to the bathroom.
Right.
Right? Okay.
For sure. Oh, and then wondering about what about keeping a routine? Does that help even though
Absolutely.
their memory's not really there, but I mean,
Yeah.
will their body recognize the routine?
Yeah. A routine is super important. Again, like that kind of goes back to do all your activities in the morning
Hmm.
and then settle into a nice quiet routine in
Okay.
the evening
Right.
can definitely help. Anything that's disruptive, kind of like we were talking about with the hospital stay, anything that's just disruptive or new or people coming to visit, that kind of stuff is just really hard on our dementia patients to have anything like that going on in the evening. So
Right.
yeah, a nice mellow routine that you just stick with every evening that they can expect
Hmm.
what's going on, that can help. Um, Also, one more thing that can cause some of the agitation with sundowners is your anti-psych and antidepressive meds.
Hmm.
It is best to, so with the timing with those, especially if you're giving them for sundowning and that when that agitation starts to amp up, you
Hmm.
may want to time those in the afternoon, an hour or two before you've historically seen that
Oh,
pattern
okay.
start. So, um, yeah, it's real important to try to fit that in an afternoon med, maybe with the afternoon snack.
Okay. So there is medication to help it?
Yeah, so
Oh.
sometimes just anti-anxiety
Uh-huh.
and antidepressants can help
Okay.
with the sundowning.
Mm.
Yeah,
Okay.
because people that feel depressed, also there's a component where confusion and depression kind of go hand in hand.
Hmm.
So if you're someone who just due to sleep deprivation or the serotonin levels are just out of whack because of the dementia, things like that can cause depression. So sometimes these medications help boost that a little bit in the afternoon and keep it an even keel all day.
Okay.
Yeah.
Great. And how can sugar and spice help?
Sugar and spice can help because sometimes you just need a buddy to be with that person through that part of the day. If you are a family caregiver, that might be your busiest, most challenging part of the day. Kids are coming home from school. You've got dinner to make. You've got, whatever, friends coming over for dinner. You're running in and out taking kids to practices, you're trying to get to your appointments. It's maybe you're just coming home from work and now you've got everything at home that piled up during the day that you've got to take care of.
Yeah.
So that's where it can just really help to have a caregiver come and stay with your loved one and just be dedicated to them. A lot of times one of the signs of this afternoon sundowning is repetitive questioning. They're very confused. They want someone to, they become a lot more needy. We'll just put it that way. They're restless, so they're up and down. There could be more of a fall risk. So now you're trying to run back and forth between the oven and making sure that they're not falling while they're getting up
Right.
again to go do who knows what because they don't really know what they need. So yeah, just having a dedicated person to get you through that rough part of the day can be very helpful.
Yeah,
Yeah.
absolutely. Well, thank you so much.
You're welcome.
And thank you everyone that joined us today, and we'll see you next week.
All right. See you soon.
Bye.
Bye.